Are any of you guys suffering from knee pain but nothing sore to touch? Hey guys, my name's Dan, physiotherapist here at New Age Physiotherapy. Today we're going to talk about a fairly common knee injury that's called patellofemoral pain syndrome, right? So what is patellofemoral pain syndrome? What it is basically, it's a biomechanical issue of the knee which causes the kneecap to track the wrong way, which causes a lot of friction between the kneecap and your femur, right? So what causes this biomechanical issue? On the side of your knee over here, you have something called your ITB, your iliotibial band, which is a band of connective tissue that runs just into the side of the knee and articulates with a lot of the structures over here. And what can happen sometimes is, through muscular imbalances, poor mechanics, this band gets overly tight, causes your patella, your kneecap, to track out to the side a little bit too much, and causes it to get out of its articulations and cause increased friction and pain at the front of your kneecap. It's common things that people with PFJ will experience is pain when they're going up and down stairs, pain when squatting or anything weight bearing, but often nothing will be sore to actually touch their knee, alright? So what are some of the things that cause this tightness in the ITB? Well, the answer is actually lying up into your hip, believe it or not, right? So what the ITB actually comes from is two muscles. One is at the front of your hip, it's a muscle called your tensor fascia lata, and your glute at the back. That's what the ITB actually originates from, right? So first thing that we'll want to do is alleviate the tightness in these muscles, right? So first stretch that you want to do for your TFL muscle is what we call the lunge stretch. Right, what this going to do is it's going to stretch the front of your hip out. So the trick with this stretch is not to arch your back too much into it, but just tuck your bottom underneath yourself, and you should feel a pulling down to the front over there. Hold that for about 30 seconds, and then relax. Okay. The other muscle that you want to stretch is your glute. So the way to do that is come around onto the bed, bring your knee up to your chest, and then across to your opposite shoulder. And you should feel the stretching down here. So again, hold for about 30 seconds, and relax. Alright, so we've stretched everything that we need to stretch right now. We're not in any pain anymore, but now we've got to prevent this from occurring again. So, best thing to do here, strengthen your glute medius muscle. This is our best key for prevention, right? One good exercise that we like to do for this is called the clamshell. So what you do is, lying down on your side, knees bent, feet in contact with each other. All you're going to do now is lift one knee out to the side against the band, hold for about a second, and then slowly release back in. Push up, slowly release back in. You should feel some good contractions in the side of your glutes there. We'll do about 12 repetitions of that. Right. So those are just some basic exercises to do for someone with patellofemoral pain syndrome. But if you or anyone else that you know are suffering from patellofemoral pain syndrome, head over to New Age Physiotherapy Austral or give us a call on 9606 8258. Alright, thanks guys.